This conference will
And
now be recorded.
we are now off. Ethan, I'll let you do your introductions. Thanks.
Thank you. Good morning. On behalf of the Department of Consumer and Business Services, Division of Financial Regulation, I'm Ethan Baldwin, and I welcome you to this public hearing to discuss the Division's preliminary rate decisions for 2021 health benefit plans. The Division holds hearings on all individual and small group rate filings. Each hearing is generally limited to discussion of the Division's preliminary decision and final objections regarding the filing. During this time, carriers will be permitted to defend their assumptions using information submitted in the filing or indicate agreement with the findings. Carriers may not introduce new information or propose new or revised assumptions at this time. When reviewing a rate request, division actuaries consider such factors as recent and projected medical care and prescription drug costs, including any benefit changes, past and future loss ratios, that is, how much of every premium dollar goes to pay healthcare claims costs. This is to ensure the requested rate is not projected to trigger federal rebates or payments from other federal programs. Actuaries also review the recent history of rate changes and the overall financial strength, including profitability, investment income, and surplus of the company, as well as administrative costs. Division staff also ensure that the filings meet all requirements of the Affordable Care Act and determine whether or not the anticipated number of enrollees will adversely affect an insurer's financial position. You can review the full rate requests for all the companies on our website, www.oregonhealthrates.org. All communication for every health insurance rate change filing, including written answers to all questions asked during the review period, are posted there as well. In this morning's hearing, we are discussing in this order the preliminary rate decisions that the Division has made on small group health benefit plans filed by HealthNet Health Plan of Oregon, Inc., United Healthcare Insurance Company, and United Healthcare of Oregon, Inc. Our agenda will be representatives from each company describing their rate requests. Then Division staff will lead a discussion about the Division's preliminary decision on each filing. Finally, we will accept public testimony. If you'd like to make a comment on the company's filing, please wait until the proper time when I announce it. Unmute yourself, introduce yourself, and make your comment. Comments will also be accepted online through 11:59 p.m. on today, July 8th. The Division will make a final decision about these rate filings shortly after the public comment period ends today. HealthNet, please begin by introducing yourself and explaining your rate request.
Hi, good morning. This is Thomas Lai representing the HealthNet Health Plan of Oregon. I will be going through our 2021 Q1 small group rate filing. To kick things off, the annual rate increase we are requesting, the year-over-year average is 6.2%, with the minimum being negative 19.2%, up to 16%. Broken down into the quarter level, the average quarter over quarter is a 2.9% increase, with a maximum of negative 12.7% and 11.2%. As of February 2020, we have about 2,879 members on ACA compliant plans. In terms of the plan changes, both new and discontinued and changes, we are adding 14 new plans to the 2021 portfolio. This consists of 4 platinum plans, 4 gold plans, and 6 silver plans. We are discontinuing 16 of the previous plans from the 2020 portfolio, 14 of which are statewide PPO plans, 2 community care plans, and 2 community care 3T plans. I guess the variant of the same 1T, 3T community care plans. In terms of changes to the other plans, the 2020 plans are modified to fit into the 2021 AV calculator as a result of the portfolio refresh. In terms of the factors that have been revised since last year, most of these factors have remained the same. In terms of area factors, we've slightly increased the area factor for region 4, and offsetting that by slight decreases in regions 5, 6, and 7. In terms of age factors, the age factor has decreased by 2.5% compared to our last filing, which was in Q2 of 2020. We did not make any changes since the initial submission of the filing. The DFR also reached out to us in regards to a few questions regarding COVID-19, so I'll address those as well. So the question was, has the original estimate on COVID-19 costs changed for 2020 through 2021. Based on updates to our corporate model, we're expecting that the cost for 2021 to be about $24 PMPM. The second question being, is the company requesting that we change the rates due to this emerging data? At this time, we are not requesting any changes to the 2021 Q1 rates. And the last question was, how will postponed claims affect pent-up demand utilization in 2021? Based on the aforementioned corporate model, we're expecting that services that were elective or I guess put off in the beginning half of 2020 to start coming back later in the latter half of the year and extend through 2021, probably up through June to July in our current estimates. We expect that to have maybe a 1 to 2% increase in claims in 2021. And that's all I have for now.
Thank you. Division staff will now lead a discussion about the division's review of the filing and preliminary decision.
Thanks, Ethan. Good morning, everyone. My name is Ying Liu. I'm the primary review of this filing. So the company requested, sorry, I forgot to let other people to announce. I think TK and Lou is on the phone.
Yeah, hi,
as well.
this is Lou. Yeah, Lou Savage, Administrator for the Division of Financial Regulation.
Yeah, TK Keene, Deputy Administrator with the division.
And this is Brian Fordham. I'm sitting in for Tasha Sidemore, Program Manager, Property Casualty.
Okay, thank you. So the company requests 6.2% average annual rate increase from the first quarter of 2020 rates. Since the company filed the second quarter 2020 rate change, so the total annual impact for this filing is actually 7%. So as the company just mentioned, the minimum rate change is a 19.2% reduction, and the maximum rate change is 16.7% rate increase. So the division's preliminary decision is approved as filed based on our review. The rate change was developed based on the 2019 experience. And during the experience period, the company had about 2,700 members, and the total premium was around $17 million. The medical loss ratio was 86.1% before applying any risk adjustment. The risk adjustment amount was based on the consulting firm weekly estimate, which is higher than the market average risk with about $68 PMPM risk adjustment receivable from the pool. In the experience period, the company also considered the pharmacy rebate. It was a total of $160,000 in 2019 and translate to about $5 PMPM. The rebate was applied across the board to reduce the claim cost. So that's for the experience period, for the starting point of this filing, the calculating the rates. And then projecting into the 2021, the following are the key items that addressed in the filing. First, the pricing trend is 6.6%, vary by medical and pharmacy. Those are consistent with the market-wide projections. The company also observed there was a shift in plan mix, a tendency of members moving to the richer plans. So a plan adjustment of 2.6% accounted for that shift. Those also changed to the cost-sharing designs of the plans, which translate to a factor of 0.981. For the risk adjustment part, the company projected a similar relativity as the experience period of 2019. The projected risk adjustment amount is trended from the 2019, and then the result is $73 PMPM receivable from the risk pool. For the COVID impact, the company made a projection of 3% impact. To offset the impact, though, the company built 0% profit and margin in the rates and expect to rebuild the profit margin as the situation with the COVID normalize. We consider that the company's position to evaluate the COVID impact in conjunction with the profit margin is appropriate. The filing also included 14.5% administrative cost, which includes expenses, taxes, and fees. As a result, the projected medical loss ratio based on the federal calculation is 87.5%, and the required rate change from the first quarter of 2020 is 6.2%. We consider the above assumptions reasonable and are supported. The division agreed on the company's methodology and calculation. So the division's preliminary decision is approve the rate change as filed. And we will also considering the new COVID data presented by the company today for the final decision. Thank you. I will turn it back to Ethan.
Thank you. HealthNet, do you have any additional information or comments you'd like to make at this time?
No additional comments right now.
Great. We will now take any public testimony. If anyone would like to provide any, please unmute and introduce yourself. All right, hearing none. No one has signed up to testify, so let me remind anyone listening that today is the last day for public comments. Comments can be submitted through our website, www.oregonhealthrates.org. Next, we will hear from United Healthcare Insurance Company. We will pause briefly. And now I'll ask United to please begin by introducing themselves and explaining their rate request.
All right. Let me share my screen. Just give me 1 minute. All right. Thank you very much, Ethan, and thank you, Division, for a careful review of our rate filing. And thank you for giving me the opportunity to present to you the summary elements of our proposed rates for small group market for 2021. So let's see. Before we discuss the meeting agenda, my name is Shamsher Plaha, and I'm a pricing director with United Healthcare. And in today's meeting, we will discuss the summary of our rate request for small group 2021. And then we'll also discuss some additional items. So those are the COVID impact as well as the CMS final risk adjustment report, which we have not received yet. In terms of the summary of our rate request for 2021, the legal name of the company is United Healthcare Insurance Company, and the average rate for all 4 quarters for 2021 over 2020 is minus 1.1%. And the range of average annual rate increases for this period, so that's minus 16.8% to positive 19.5%. And also we made some portfolio changes, benefit changes to reflect, the new actuarial value calculator, and also to have some more consumer specific initiatives in our product. And that impact is negative 7.4%. So this is small group market, and starting 4/1/2021, we are also requesting a quarterly trend increase of 1.9%, which is equivalent to an annual trend of 8%. And this filing will affect 13,623 members as of March of 2020. In terms of our portfolio for 2021, we will be offering 44 plans. Out of 44 plans, 19 plans are the renewing plans from 2020, and we are introducing 25 new plans. In terms of the factors that will be changed in this rate filing since the last rate filing, that was 2020. So there'll be 4 factors. The first one, the base rate will be changing. Then the quarterly pricing trend, so that is changing from 2% from 2020 to 1.9%. And on an annual basis, it's a change from 8.1% to 8.0%. The area factors are also changed, as well as the plan factors or plan relativities. Since our submission, there were no requests for change in the rate and no errors were identified in our rate calculation. And that concludes the summary of our rate change request for 2021. The next item is,
Go ahead.
Sorry?
Oh, go ahead, please.
Okay. The next item is the impact of COVID-19. The one thing is, in our original rate request, we did not include any COVID impact in our rates. The company is still assessing the emerging experience, as there is a lot of uncertainty associated with it, and we are getting new data on a daily basis. And we believe that in week or 2 weeks, we will have better estimation that if there is any impact to our 2021 proposed premium rates. The next item I would like to mention is the CMS Risk Adjustment. The report is not released yet, and we are expecting to have the final risk adjustment amount to be released by CMS next week. And once we see the report, we may request to change the rates, premium rates, based on the numbers that we will see in that report. And that concludes the summary as well as the additional discussion items. So I'll hand it back to Ethan.
Thank you. Division staff will now lead a discussion about the division's review of the filing and preliminary decision.
Thanks, Ethan. Good morning. My name is Ying Liu. I'm the primary review of this filing.
Hi, this
So-
is Lou Savage, Administrator for DFR.
TK Keene, Deputy Administrator with DFR.
I'm Brian Fordham, sitting in for Tasha Sizemore with DFR.
Back to the filing for 2021, the company requested 1.1% rate reduction from the first quarter of 2020 rates. As mentioned by the company, the minimum rate change is 16.8% reduction, and the maximum rate change is 19.5% increase. After our review, the division's preliminary decision is proof as filed. So we reviewed the experience presented in the filing. The rate change was developed based on the 2019 experience, and during the experience period, the company had about 18,000 members with $95 million premium. The medical loss ratio was 83.6 before applying any risk adjustment. The company anticipated a lower than market average risk score in 2019 and estimated 1.6% risk adjustment payment to the poor. So after the risk adjustment applied, the medical loss ratio is about 85% for 2019. Projecting into 2021, there are a couple of the items that addressed in the filing, but it's not limited to that list. I'm going to mention. So the first is So there is a decrease in membership. The project membership in 2021 is about 13,600. It's about 20% decrease in membership from 2019. The company projected a risk adjustment payment similar to the experience period, which is 1.6% risk adjustment payment to the pool. Like mentioned by the company, the pricing trend is 8% annually, change from last year's 8.1%. So 8% is equivalent to 1.9% quarterly trend. At the time of the filing, there is no extra COVID-related impact was assumed. So with all the uncertainty of the situation, on top of that, the company includes 17.9% administrative cost, which includes expenses, margin, taxes, and fees. As a result, the overall medical loss ratio based on the federal calculation is 84.4%. And then the required rate change is 1.1% reduction from the first quarter of 2020. We consider the above assumptions reasonable and are supported, and agreed on the methodology and calculation. The primary decision is approve the 1.1% rate reduction, but we will also be considering new COVID data and risk adjustment, like mentioned by the company, for the final decision. So that's all. I turn it back to Ethan. Thank you.
Thank you. United, do you have any additional information or comments you'd like to make at this time?
We are good. Thanks, Ethan.
Great. We'll now take any public testimony. Please unmute and introduce yourselves. All right. Well, let me remind everyone listening that today is the last day for public comments. Those comments can be submitted through our website, www.oregonhealthrates.org. Next, we will hear from United of Oregon, and we will pause briefly. All right. United of Oregon, please begin by introducing yourself and explain your rate request.
Thanks, Ethan, and thank you, Division, for a careful review of our rate filing for small group market for 2021. My name is Shamsher Plaha, and I'm a pricing director with United Healthcare. So here we will discuss the summary of our rate request for 2021, as well as we'll discuss some additional items that those are COVID impact, as well as the CMS final risk adjustment. So start with the summary of our rate change request. First, the legal name of the company is United Healthcare of Oregon. And the average rate increase that we are requesting is 6.2% for 2021 over 2020. And the range of average annual rate increases for this period is 2.6% of increase to 9.6% of increase. For small group market, we are also requesting a quarterly trend increase starting with 4/1/2021, and the quarterly trend that we are requesting is 1.9%, which is equivalent to 8.0% on an annual basis. This filing will affect 0 members as there are no members on this license. In terms of portfolio, we will be offering 2 plans. These are 2 standard plans, and those plans are continuing from our 2020 portfolio. There are 4 factors that will be changed with this filing since the last filing of 2020, and those factors are base rate, the quarterly pricing trend that is changing from 2% to 1.9%. And on an annual basis, it is a change from 8.1% to 8.0%. Area factors are also revised, as well as plan factors or plan relativities. There were no changes to the rates that were requested, and no errors were found in terms of determining our proposed rates for 2021 since the original submission of this filing. And that concludes the summary of our rate change request. Additional items that we'll discuss, the first one is the impact of COVID-19. As you all know, that the experience is really changing on a daily basis, and company is closely monitoring the emerging experience, and we think that we will have better estimate in week or 2 weeks. And we'll see if we will like to reflect that in our proposed premium rate for 2021 at that point. The next item to consider is the final CMS Risk Adjustment report, which is not released yet, and we are hoping to receive it next week. Once we see the report, we will see if we would like to request a rate change based on the amounts reflected in that report. And that concludes the summary and the discussion from United Healthcare of Oregon. And I'll hand it back to Ethan.
Thank you. Division staff will now lead a discussion about the review of the filing and preliminary decision.
Thank you, Ethan. Good morning. My name is Ying Liu. I'm the primary review of this filing.
Hi, this is Lou Savage, Administrator for the Division of Financial Regulation.
TK Keene, Deputy Administrator with the division.
And Brian Fordham sitting in for Tasha Sizemore, Program Manager with the division.
Okay, back to the filing discussion. So the company requested 6.2% annual rate change from the first quarter of 2020 rates. The division's preliminary decision is prove as filed. So the company doesn't have any membership in 2020, and then the rate was developed mainly based on the United Health Insurance Company's small group experience and the projections. The proposed rate change also follows the United Health Insurance Company's small group rates. Since the company has zero experience, the division agreed with the way the company developed the rates. The division's preliminary decision is approve the 6.2% rate change as filed. And also, like the company just presented, if the company has further COVID-related new information and the risk adjustment update, please share with us, and we will consider it in our final decision. Thank you. That's all. I will turn it back to Ethan.
Thank you. United of Oregon, do you have any additional information or comments you'd like to make at this time?
We are good. Thank you again for the review.
Great. We will now open it up to public testimony. Please unmute and introduce yourself. All right, hearing none, I'll remind everyone listening that today is the last day for public comments. They can be submitted through our website, www.oregonhealthrates.org. Thank you, and that concludes today's hearing.
Thank you, everyone.
Thanks.
Thank you.
Thank you.